And here we go. There we go. We are live. Hi, everybody. Welcome to social chats, short health spaces. And I'm trying to see why I don't hear any audio coming. There we go.
Yep, I can hear you.
Give me one more minute. I got to turn on the other recording. I just hit the live stream. Oh, my friend Charles is in here too. Hi, Charles. Okay, so we are going to, let me record the space. And again, today's space is only 30 minutes. That's why we're calling it the short health space. Two more minutes. Some reason my Okay. Hi, everybody. Welcome to our short health spaces. We do this weekly on Wednesday for 30 minutes. And this week's going to be about men's health. And I have here with is Dr. Kumar. He's going to be talking about what is a pea shot. But let's say hi. Hi, Dr. Kumar. How are you?
I'm doing wonderful, Tanya. Thank you for bringing me on board.
Yeah, I'm loving. I learned so much within 30 minutes of our show. Everything you've been teaching me, so I love it.
Yeah, we're going to be discussing some sensitive topics out here today.
Yeah, this is about men's sexual health. So, full disclaimer, everyone. And let me share the story real quick. Dr. Kima, the mic is yours. I'm gonna go. I'm gonna pin it up.
Cool. Are we ready?
Yep, we're all ready.
Okay, cool. All right. So listen, by a show of hands, if you can, how many of you know what a pea shot is? I know you can probably Google it and find out, but just offhand. Okay, one. All right, that's it. Okay, so a pea shot. The P in the P shot stands for a Priapus shot. PRIAPUS. It's also called PRP, platelet-rich plasma. Hey, can we turn off this music anyway, Tanya?
You can hear
Oh,
music on here. I don't hear
yeah,
any
yeah,
music.
yeah. I'm good. I'm good. Okay. All right. So basically, the P shot stands for Priapus shot, as also a PRP or platelet-rich plasma shot. Now, just to get started, let's talk about what PRP is. PRP is what's called platelet-rich plasma. Now, platelet-rich plasma is the concentrate that we obtain by spinning the patient's own blood. We remove white cells, red cells, and isolate what's called platelet-rich plasma. Now, why is that important? Platelet-rich plasma is an incredibly powerful concentrate that contains a bunch of stem cells, nutrient, growth factors, and so many other things that can help in repair and regeneration of tissue. The key here is it works only where it's administered. In other words, it has a local action. So you cannot do PRP like IV, you're just going to dilute it out in the blood. So where is this been useful? It's been useful in patients with tendinopathies. Not at the first line, you go through whatever procedures that you need to do, but if you want to achieve repair and regeneration of tissue, instead of stepping into the stem cell and the exosome world, which is currently illegal in the United States, platelet rich plasma is a great alternative to manage these situations. So, when we use PRP for sexual function in men, basically anything to do with erectile dysfunction and Peyronie's disease. So, those are the two indications that we use the P shot. Now, so let's talk about erectile dysfunction and explain to you exactly how the P shot kind of finds a place in that area. So most patients who come in, or most men who come in with erectile dysfunction, it's mostly a vascular function, which means the blood doesn't go into the penis area, doesn't stay in, and basically there's no function. So when you combine PRP with acoustic wave therapy, which is also called shock wave therapy, in my world we call it Gainswave. So when you combine shockwave therapy, what you're doing is, you're shaking up that tissue, the vascular tissue in the penile area and all around it, and you're clearing up all the plaque buildup that has prevented flow of blood into those areas. Now, when you want to add regeneration to the mix, then you add the P shot. So how do we do that? So we do a series of sessions with Gainswave, anywhere from 3 to 6 sessions, depending on the severity of the erectile dysfunction. And so at the last session is when we add the P shot. So the patient comes in, and we do the Gainswave procedure, it takes about 20 minutes. We pull the blood out from the patient, we spin it. There are different techniques and companies that have different protocols for this. And we isolate the platelet rich plasma, and we inject that platelet rich plasma in set spots on the penile area. Now the P shot is a brand name, and hats off to Dr. Charles Runels, who kind of created this protocol, and he has over 4,000 members in his group. I'm one of them. I'm really privileged to be part of this group. We learn a lot through him. He's always innovating things that he finds interesting and is effective for our patients. So he's at the cutting edge of medicine when it comes to sexual medicine, short of a penile implant. So where we fit in with Gainswave and the P shot is between, where the Viagra and Cialis stop working, and at the other end is a penile implant. So we fill that gap between these two extremes. So instead of the patients going in, flying straight in for a penile implant, we try to kind of either postpone it or have no need for the penile implant if what we do works. Now, patient selection is important. So not everybody who calls us qualifies for a P shot right away. Not everybody who calls us for erectile dysfunction will qualify for Gainswave right away. So there is a medical evaluation that goes on behind the scenes to make sure that the Gainswave procedure and the P shot is appropriate for that particular individual. Now, are there times where we do the Gainswave only? Yeah, we do Gainswave procedures only without the need for a P shot, based on the severity of the erectile dysfunction, and if the patient qualifies, obviously, medically stable, no history of smoking, but diabetes is under control, the cholesterol levels are under control. So where do we add the P shot when we want that extra jump on their scoring? When we look at severe erectile dysfunction or moderate erectile dysfunction, adding a P shot will definitely improve outcomes in terms of better sexual function in men. So that goes for erectile dysfunction by itself. Now, Peyronie's disease is a whole different ballgame. I'm sure a lot of people are not aware of this, but the statistics show that anywhere from about 5% to about 20% of the male population in the US have some form of Peyronie's disease. So, what is Peyronie's disease? It's a curvature of the penis that occurs because of what we call plaque formation, which means there's a small amount of scar tissue that sets in on one side of the penis, either the top or the bottom or the side, which which has the penis bend at that particular point. Occasionally very painful, but it's more common than we think. So most of these conditions go undiagnosed because of the shame that's involved with these patients. And again, it's no fault of theirs. It just happens to be one of those conditions, and we really don't know what causes it. The stories that I hear from my patients is because of some form of trauma. But many times it's just happens out of the blue. So so these folks who are suffering with this, fail to have relationships, fail to have a healthy sexual life. I mean, they suffer through it, come in with all kinds of psychological issues and stuff like that. So this is something that we really need to highlight to kind of bring this entity into the open, because there are solutions for it. Now, till we came up with the Gainswave and the P shot for this condition, the only thing that was available for these patients was penile surgery. Recently, they've come up with a local injection, which is an enzyme called a collagenase that, when infiltrated into the scar tissue, can help dissolve that. But the patients that come to me have failed even that. So when they come in, they're at the wit's end. So they're just shy of getting into the hands of a urologist who's getting ready to do a penile implant. So this is just one way of trying to either postpone the need for a penile implant or to take it out of the equation altogether. So when we do the P shot in these conditions, so many of these conditions may or may not have erectile dysfunction. So not every Peyronie's disease has ED. It's something that we need to keep in mind. And not every ED is related to Peyronie's disease. So they're kind of independent of each other. So when we use PRP for these conditions, like I said, the results depend on how long the plaque has been around, how large the plaque is. And so we may have to do this procedure, maybe every 6 months or every year, because we have not been able to isolate what the underlying condition was. Yes, if there was a history of trauma, anything like that we can advise the patient to kind of be careful about that. But many times we just don't know. So whatever caused the initial event of creating that plaque formation continues to persist, and so we just have to keep fighting it. So that's the take that I have when it comes to the P shot. Now, a question comes in whether the P shot can actually increase the penis size. Again, the newer data that's coming out, we believe that it does increase penis size, but it's not something that we promise the patient. We can tell them, obviously, because more blood seems to be entering the penis by opening up all the blood vessels, that they may feel that there may be an increase in size, but it's not something that we go about measuring. But anyway, what we do count upon is, the satisfaction level. Have the relationships gone back to more than what it was before? Are they able to perform better? Are they able to last longer? Are they able to enjoy life much more than what they had, before we went on this pathway? And again, like I said, we need to make sure that we pick and choose the right patient for any of these procedures. These are medical procedures. So we need to be respectful of that and make sure that whatever we do our fundamental work to make sure that the success rate with both the Gainswave and the P shot is at its maximum level possible. You can't have somebody walking into the door with, weighing 300 pounds with blood sugar levels of 250, A1C of, 9, and expect to get results. Ain't going to happen. So this is so critical. And also it's important to make sure that we have, adequate levels of testosterone, make sure the patients are not smoking, because if they're smoking, nothing's going to work.
Or drinking, right? Too much alcohol.
Yeah, or alcohol. Yeah. We got to make sure that, number one, if they feel that sexual function is a priority, they need to clean up the rest of this stuff, both medically, socially, the whole nine yards. So they need to come in with a clean plate. And again, not everybody patient comes in, in a perfect situation, but at least we can be realistic about expectations. And once they realize that they need to do a lot more work at home to get the results that they're looking for, that will really help them, motivate them to get moving in the right direction. So I've been doing this. So I'm an oncologist, by the way. I need to introduce myself. I'm Dr. Kumar. I'm a radiation oncologist. I've been dealing with prostate cancers forever, for over 20 years plus. So the reason I embarked on sexual medicine, because of the effects of erectile dysfunction in my cancer survivors. You know,
I was gonna
met Dr. Charles Ronels, became member of his organization, underwent training with them. So I've been happy to say that I've had incredible successes over the past 4 years. And I'm located in the Palm Beach area and in the Port St. Lucie area. If anybody has any questions, they can always reach out to me.
Is there any side effects to the P shot?
So the side effects are, number one, make sure they're not on anticoagulants. Again, the chances are this is such a tiny needle that we use, but we tell them to lay off taking any kind of aspirin or any kind of anticoagulants for at least a day or two before they come in for the P shot. Again, I've had patients who come in with aspirin on board. I've not had any side effects at all. So no side effect to speak of, because this the PRP is the patient's own blood. You see, so there's very little manipulation of that platelet-rich plasma. It goes straight back into the body. The key here is it's the concentrated nectar of life. Remember, so it has all the necessary ingredients to actually regenerate tissue in the penile area when it comes to the P shot. So repair and regeneration and rejuvenation is the way you can look at it. I mean, there are several other areas where we use PRP. You can use PRP for the head, for hair growth. You can use it on the face for facial rejuvenation. You can use it into joints for arthritic pains and stuff like that. So there are several indications, but when it comes to male sexual function, we call it the P shot. And there's an equivalent version for females too. It's called the O shot, also called the orgasm shot for females. I mean, that's a huge discussion by itself. So we can talk about that another day. But right now, if anybody has any specific questions about the P shot, I'd be happy to answer.
So I have my good friend Melody here.
Right.
Hi, Melody. How are you?
Hi, Tonya. Long time. I
It's been
haven't.
a long time. How's Ireland?
Ireland is warm actually today. It's very warm, which is unusual for March, but hey, we welcome it.
So Melody's a love coach.
Ah, the love
Yeah,
doctor, the love coach.
and I
Love.
love the work you're doing because if people are not enjoying their sex lives, the love goes down very quickly. So
Hey,
well done.
listen, I have a theory in mind.
Mm.
Okay, if we can offer P shot to every person on the planet who's at war, you think they'll be able to lift a gun? They'll be happy sitting at home with their
Oh
wives,
yes,
girlfriend,
I love it. I love it so much.
right? Why would
I
again? I don't want to get into the politics of it all. Oh my God! Just give me 10 minutes with Putin. I'll fix him. He's going to be a
Yes,
happy kid.
I totally agree. I think I've always said this as well, that if people were enjoying their sex lives, they wouldn't have time to be bitter and angry and lift a gun, like you've said. You are so right. I agree totally.
Yeah, lift your own little gun and have fun with it. Not the machine gun.
Oh my God.
Let's fix that gun first. The little gun, your personal gun.
Yes, and forget about
It's
who
crazy.
said what. Yeah.
Crazy. If we can bring joy back to civilization, I tell you what,
Mhm.
it's going to be such a peaceful planet instead of all
Yes.
the turmoil that we see. And I think what's really behind it, again, I'm not a psychologist, I'm not a psychiatrist, but I'll take a bet a large part of it is somehow connected to sexual frustration.
Yes, and also I agree totally, and I also think we don't take enough time to heal from stuff that happens to us. We just, soldier on, and we think, okay, I'm over that, I can move on, but we don't take the time to unpack and heal that so much that you have space to love and enjoy life instead of being angry and bitter all the time.
Yeah, unfortunately, that seems to be the default in that I'm seeing. Again, for the past year or so. I mean, look at the fires burning around the planet. Oh my God, really?
Mm,
If
yeah.
you can just make everybody happy, Iran is going to be at peace. I mean, the Middle East is not going to be at war. Russia will not have any reason to go to another country.
Mm-hmm.
Again, I sympathize. I just pray for peace around the planet, guys. I mean, I'm not a politician and I don't care for politics, but I just pray for peace every second of the day.
I agree with you. I pray for peace as well. And I think also if women were allowed to be who they need to be in the world, there will be less war because, we would calm you guys down. But then most men who go to war don't allow their wives near them at all. So, so it doesn't really work. But
Yeah,
if they were allowed to just, get together and just say, calm down, things will be much better. Much,
yeah,
much
yeah,
better.
yeah,
Mhm.
yeah, yeah. And the thing is, there's enough to go around the planet to keep everybody
Yes.
happy. I mean, we all can meet our basic resource. I mean, needs.
Yes.
Basic needs. As human beings, we have our little needs. Once we finish that, I mean, what's there any reason to go grab somebody else or steal from somebody? There's absolutely no reason for that. Again, I'm just ventilating because this is like top of my mind right now. I mean, we need peace on this planet. We can't have this. This is like a throwback to the 1500s.
Yes, it is,
Like,
and it's so unfortunate because we have advanced the technology so much that when we go to war, we don't just shoot one person dead.
yeah,
We destroy every surface area he's standing on, including all the bugs and living organisms that are around him. And we think we are doing great, and it's unfortunate.
yeah, yeah. Can you give me 1 second?
Sure. Hi,
Okay.
Charles. How's it going? Melody, you gotta say hi to Charles. This is my new friend.
Hi, Charles. How are
Hey,
you?
Melody. I'm seeing. I think Melody and I are from the same country in terms of heritage. I just think so. But yeah, hey Tanya, this is a fantastic space. I have to say, Dr. Ramesh, thank you very much for being so comprehensive. This has been an eye opener. I really started thinking about it from the perspective of prostate cancer survivors and how their quality of life can sometimes be depleted after surviving a cancer ordeal. And just knowing that there are people like you who also take the extra mile to try and make sure that people who have gone through some, prostate cancer issues or other type of issues which are related to erectile dysfunction can still be able to have a good quality of life and still be able to feel like they are able to perform and have that confidence. I like that you're doing that for sure. I really do. So thank you very much. I'm really enjoying the space and, thank you again to Tanya. Terrific space that you've conducted. Yeah.
Thanks, Charles. Yeah, we do this every Wednesday. It's a 30-minute space. Dr. Kumar shares some of the stuff that he knows and kind of like just to let people think about it. We've talked about everything, and we're going to continue on because, he, besides being an incredible oncologist, he's also an acupuncturist, and he does integrative medicine and functional medicine, and regenerative medicine. So this is, I feel very blessed to have him in my circle because, I learned so much from him. And I think men's health is so important to talk about and share. And because, when it comes to men, they don't really like talking about their health. I mean, like my hubby, I'm always like bugging. I'm like, how are you feeling today? What's going on there? Why are you? And I sound like a nag, but men don't like talking about their health. I don't know why, but they don't like. I guess it's they don't want to seem weak, or I don't know. Charles, do you talk about your health? How you feeling?
I was trying to get off my my mic. So for full disclosure, this is actually my first time using Spaces, like Twitter Spaces, and I had to do it because I want to support Tonya, and this has been such a wonderful space. I did not really expect this when I was coming here to be so captured by the topic. And now, in terms of my health, Tonya, I'd say that physically definitely very fine, but mentally, like you said, I think it's a case where each and every man at some point has some anxiety surrounding exactly what we're discussing right now. Whether it's that some will feel that they're inadequate, and then some might also feel like maybe they have too much. Either way, like there's always anxiety surrounding that. Whatever anyone tells you, there's always a lot of anxiety surrounding performance and just how you're able to be as a man. So I think from a standpoint of mental health regarding this topic, every single man, whether they're blessed, whether they're somewhat depleted, each and every single man has some anxiety surrounding this. So this is why I like having topics like this. And hopefully that answer's not all over the place, Tonya.
Oh no, you're fine. Like I said, it's just the whole idea about this is be 30 minutes because Dr. Kumar is like in between. He has a busy practice, so we agree that just to do 30 minutes and kind of talk about it. And our goal is just to like educate and get people to talk more about themselves and their health. And men, like women go through menopause, men go through andropause. So we'll have to do a space about that, Dr. Kumar.
Oh, yes, we do. I would love to listen to that.
And men has andropause, and they start early too. Like it varies. I think like around 40. I think men start feeling their changes. Sometimes late 30s. Also, women's menopause it varies too. But I noticed, and the only reason I understand this quite a bit because in my early days, and I worked for a compounding pharmacy, so I had to work with a urologist. A lot of doctors who deal with men's health. So I learned a lot about men and testosterone and how in their 30s, the testosterone starts to deplete, which causes a lot of different issues in their system. And then the andropause, they start getting hot flashes. Men get the same type of symptoms as we do. Some of it, some more actually.
Wow, that's very yeah, I've never had that before. Thank you so much, Tonya. I really love that. And please come back and talk about other men's issues. Because you know how as a love coach, I need to understand that so I can tell my girls how to look after or help to support their men to look after themselves,
Oh yeah, this is very, very important because men's hormones drop like in their 30s, so they don't see that. They're like they keep it quiet. But men, if they don't take care of themselves, by the time they're in their 50s, they'll have as much estrogen as their wives in their late 50s. So that's why they call it grumpy old men because estrogen in men is not too good. It's the testosterone that they need to make sure they're optimal.
Yeah, okay. Wow, that's amazing. Thanks, Tonya.
Yeah, I used to sit around with doctors and talk about protocol on men's health. I just freaking love it because I think it's interesting. Women is harder. Women's sexual health is so much more because we have so many more hormones. I mean, we have like 3 different estrogen. And men they have estrogen, but they have to be careful with the estrogen dominated. But this testosterone, and and everything goes hand in hand as far as the sexual health. You look at the thyroid, the hormones, the T3, T4, TSH, all those go hand in hand. So I think Dr. Kumar is at work now because he's not responding. I muted you, Dr. Kumar. I think it's 2:00, so I know you have to go, and he must be in his office because I want him to talk about that. But yeah, Melody, we should do a space. I mean, I'll get Dr. Kumar. We'll be back next Wednesday, but Dr. Kumar can help us talk some more about that. But I love to talk about Andropause and for men's health, Dr. Kumar.
Absolutely. Tanya, you may want to tell them how to find the recordings from our previous talks. We've talked about Gainswave, we've talked about testosterone in the previous recordings.
Yeah, it's all on YouTube. I'm actually building I just finished the subdomain site for our show. So it's health.socialchats.co. I'm finishing. I got to upload all the shows on there, but right now it's on YouTube. I'm going to start resharing it out again, but it's all on YouTube. It's on social chat. It's youtube.com/social chats, and you'll see the our videos and stuff. I have a whole playlist for us. I try to keep it all organized so when I blog about it, I can, and then I haven't had a chance to go back and cut up the little snippets so we can use them for different blogs and different stories.
Love it. Thank you so much, guys. I have to go actually because I'm in another meeting, but I'll be back next week.
Thank you. And Dr. Kumar, tell us how to get a hold of you.
Hey, my website is LifeWellMD.com. And the contact phone number you guys can either call or text message is 772-332-9975. Again, as long as it's not too personal, general questions, I'd be happy to chat and share some information with you. All righty, got to go.
Okay, everybody, have a great day, and I'll be back at 5 p.m. with David Wood, who is the head of the Futurist in London, and also the founder of the smartphone. So it'll be interesting at 5 p.m. Perpetual Life. And again, thank you, Dr. Kumar. Bye, everybody.